focus now and get you updates of COVID. The COVID-19 positivity rate in the national capital has soared to 19.20% on Tuesday, with 917 fresh cases and 3 deaths being reported. The number of active cases stands in the national capital at over 6,800, out of which over 5,300 patients are in home isolation. So according to an official bulletin that was released by the Delhi Health Department on Tuesday evening, this is the highest positivity rate in around 7 months.
Let me go across to Dr. Sanjeev Bagai, who is joining us here on the broadcast. Good morning to you, Doctor. Thank you very much for taking out your time. Looking at the current circumstances, of course, it is not the panic kind of situation that we are witnessing, but precautions still needs to be taken.
Absolutely. Good morning. Good morning to all the viewers. So I think the message is really of caution and not panic. It is a question to be aware and not to have any anxiety. We need to keep the norms strictly adhered to. Please wear your mask. Mask will not only prevent your ingress of infection, but also prevent your human being to human being and indoor and outdoor transmission of infection. We know that the socializing is now going to pick up. The international travel has opened. And just a quick word on why this is happening is it's primarily because of the Omicron strain BA 2.75 and BA 0.5, which is antigenically distinct. It has more number of amino acid mutations which are making it more fusogenic. That means it latches on and is not using the typical ACE receptor route. It is using a backdoor entry which we call as endocyte. So it's hitchhiking and hijacking the immune system. Your old infections of Delta and Alpha are not holding good to give you natural immunity or hybrid immunity of something what we call as immune printing or immune dumping. So I think we need to be cautious. Please wear your mask. And a last quick word is your triple vaccination is important. Your third dose, the booster dose, is important because it reactivates your memory cells and which is your B cells, your antibodies, and stimulates your T cells. So your third dose is important. Please be cautious. You can continue to shed the virus through the nasal mucosa even after vaccination. And your isolation, in case you are testing positive, should be for a period of 8 to 9 days, not a mere 5 days. There is no need to panic. Please wear your mask and get yourself fully vaccinated, which is 3 vaccines.
That's right. Doctor, but do you think that there has been a sudden increase in the positivity rate, in the number of cases that have been reported? What do you think the reason for that is? Is it because of complacency, that because people had stopped wearing masks, there was a sense that the pandemic is over, so there is a lot of mingling as well, people in groups, the number of restrictions have also come down. Is that the reason, or, is there something more, something that people should be aware of?
Yeah, I think there are 2 basic causes. One is because we are not taking care of ourselves. You go to any mall, any market, any movie theater, any restaurant, any hotel, no one is practically wearing a mask. And all these are potential super spreader events. And the second is there is still a section of population which is vulnerable, which has not been triple vaccinated. So I think it's important that we get yourself 3 vaccines done. Get yourself, especially the vulnerables, the elderlies, the people with comorbidities, the aged, to be protected well. And remember, this is a different species which we are dealing with in terms of Omicron, BA 2.75 and BA 0.5. This is causing super antigens and not allowing enough of antibodies to block off the virus. So this is actually what we call as immune evasion and vaccine escape. Therefore, we are seeing a higher resurgence of what we call as breakthrough infections and reinfections, anywhere in the range of 5 times going up to 16 to 18 times more.
Dr. Bagai, a layman question, sir, because what we are witnessing right now is also a change in weather, and many cases of common cold is also coming across, and people are often confusing it with COVID, or COVID people, infected people are confusing it with common cold. So exactly how do we differentiate with the symptoms that people have been getting?
That's a very interesting question, very important clinically. During this time of the year, we see a host of upper respiratory infections, especially in children and in elderlies, which are the common viral infections. So it does not only include influenza, what we call as H1N1. There's a host of other viruses like Coxsackie and so on. And all of them cause an upper respiratory symptom. So for the first 1 or 2 days, the symptoms remain exactly the same like any other viral infections, which is fever, sore throat, headache, stuffy nose or a runny nose, mild cough, irritation, headache, body ache, and myalgia. But what actually distinguishes Omicron is that the fever will persist, you will have more severe fatigue, more headache, you need not get a loss of smell or taste, but your symptomatic symptoms override more than influenza. The carry-home message is that Omicron is not a common flu. It is more deadly. It infects more. We know that it is 6 times more lethal. Please look after yourself. This is important primarily because of the weather conditions now changing. Change in humidity and drop in temperature will suspend the virons in terms of microaerosols for a much longer time in the air. So your transmission is enhanced. Be careful of your weather. Be careful of yourself. Keep your personal hygiene up and wear a mask.
Okay, all right. I also want to ask you, Doctor, do you think the restrictions should be enforced? Because in the previous waves as well, what worked for India is the kind of restrictions that had been put in place for the vaccines as well. It had been made mandatory, but that's not been the case for the third doses or for the booster doses that have been mentioned. So whether it comes to offices, going to most places as well, even masking, now in Delhi it has been made mandatory, but in most of the other states it's not. So do you see the mandatory enforcing of these restrictions as one of the ways to curb the number of cases and hospitalizations?
Yeah, so I think we are not looking at anywhere close to any severe restrictions such as lockdown or a shutdown of the society. So what we really need is a very gentle and sensible approach calibrated to the present need of the hour, which is masking, social distancing, keep a restriction on the total number of people who are attending events. Tide over this particular surge, I will not call it a wave, this is a surge. The hospitalization rates are still low, and I think India has been saved primarily because of the monumental achievement of having reached a fantastic figure of nearing 210 crore vaccines for a population of 138 crores. So I think your triple vaccinations have helped us. I think a natural and innate immunity will help us, and mask up. Do not socialize unless it is extremely important, and keep good amount of social distancing. Keep your hands clean.
Absolutely, Dr. Bagai, because there is also a change in the mindset that is being needed, because people, often we could see them wearing their mask below their nose or on their chin. That also has gone now. People have stopped wearing masks altogether. So they need to remain cautious and careful and see to that that doesn't affect themselves or the other people around them as well. Dr. Bagai, thank you very much, sir, for taking out your time and speaking to us here on Times Now.